It is another episode of Health Diary. My name is Gladys Gashanja and we're coming to you from the Radisson Blu Arboretum. Now, while preparing this show, somebody just mentioned that technically all of us are survivors of malaria, but sadly, some do not make it to tell their story. Now, today we focus on this condition that is highly preventable, but also understand why it continues to be a thorn in the flesh. Right after this fact of a matter. Malaria is a disease caused by a parasite transmitted to humans through the bites of infected female Anopheles mosquitoes. According to the World Health Organization, over 220 million people are infected with malaria and about 405,000 people die from the disease worldwide. Most malaria cases and deaths occur in sub-Saharan Africa, and in Kenya, the disease is a leading killer of children younger than 5 years, informing the introduction of a malaria vaccine in areas of high malaria transmission.
Nilikuwa nimeenda nyumbani Siaya. Nilirudi kama mtoto ameambukizwa malaria na sikukuwa naijua. Mara ya kwanza walimpea ya shindano. Alafu akamaliza siku 3 tukarudi. Alafu wakagonjeka tena, ikarudi tu vile vile. Nikakimbia sasa Bagadi. Kufika huko, walipomuona mbio mbio tena wakaanza tena kupiga picha, waone shida ya kifua ni nini, wakarudisha tena kwa malaria. Kurudisha kwa malaria, wakarudisha tena ile dawa ya shindano. Dawa ya shindano alikunywa siku 3. After siku 3, ugonjwa iliinuka tena. Wakasema hapana. Sasa wanipe AL. Wakanipea AL. Nikakaa tena siku 2 ndio nikarudi kwa nyumba. Kama sasa amepoa. Mtoto wangu wa pili alipata malaria niliposafiri tena huko kwetu. Kurudi nilikuwa nafanya biashara. Sasa nimeweka tu akili yangu kwa biashara, sijaweka akili yangu kwa mtoto. Nikasema hapana, acha nipeleke huyu mtoto kwa private. Alikuwa anatembea. Akikunywa dawa hizo siku 3 hakukuwa anatembea. Ananiambia tu mama anataka kulala. After hiyo nilimrudisha huko kama sasa ulimi inatoka. Daktari hakumguza. Aliniambia kimbia Bagadi ama Kenyatta. Nilipofika Kenyatta ndio nilijua niko kwa hatari. Madaktari wote walisimamisha vitu zenye walikuwa wanafanya, wakakimbilia huyu mtoto. Daktari karibu aniweke kofi. Nikamwambia hapana, mimi sio daktari, na nilijaribu. Sasa aligonjeka huko alikaa miezi 2 Kenyatta. Ndio akakuja akapona. Ukiona mtoto ana mood, hachezi vizuri, inafaa upeleke mtoto hospitali, sio pharmacy. Mara mingi tunapenda pharmacy, tunakata shortcut, lakini sio pharmacy. Pharmacy nilikata shortcut karibu ni uwe mtoto.
So we've all experienced malaria one way or another. Today we try to understand why this preventable condition is still a thorn in our flesh. To help us do so, we have Dr. Sam Akech, who is a pediatrician but also attached to KEMRI. Thank you. And of course, we have Joffre, who is a survivor of malaria like many Kenyans. Yeah?
Yeah.
Thank you for your time. Dr. How does a mosquito transmit the condition?
Usually when the mosquito bites a human being, somebody who already has malaria, when it's taking the meal, it would take some of the malaria parasites that are already in that person's blood. Once it swallows those parasites, then the parasites will develop in the mosquito, will take some days, and then after some time when the mosquito bites another person, then it transmits the malaria to the next person. It circulates in the blood briefly, then after sometimes it goes into the liver. Within the liver, that's where the parasite actually multiplies, it increases its population, and that takes a number of days. It may even take up to 10 to 14 days for the malaria parasite to multiply and get enough numbers. After that, then it's released from the liver, then it gets to the blood, and that's when people start feeling the symptoms that they have malaria.
How come we hear that there are mosquitoes from one region that are infectious and others are not?
When the place is so cold, then usually, even if they bite someone with malaria and they ingest the parasites, they swallow the parasites cannot develop its full cycles for it to be transmitted to the next person. And that's where you find that in Kenya, you mainly find malaria in those places that are warm and also have plenty of water.
Now, Joffrey, you've had several bouts of malaria. Clearly, in Nairobi, we don't have malaria as such. So where is this you've been visiting that keeps transferring the infection to you?
When I travel to upcountry to visit my lovely parents in Busia, that's Busia County, that's when I realize when I come back to Nairobi, I usually get malaria. There are some symptoms when I feel joint pains, vomiting, then I just go for the test.
Okay, Daktari explained how he gets the infection, gets treated for it, but every time he goes back to that area, he gets another bout of malaria.
What Godfrey describes is really what we see with how people grow up in malaria, places with a lot of malaria. You find that when they stay there, and as they grow older, they develop some partial immunity. It means they get protected from malaria, although they may, if you test their blood, you may find that they actually have malaria, but they don't have symptoms. But then when these people leave those places where there's a lot of malaria and they are no longer getting a lot of mosquito bites, which have malaria parasites, they tend to lose that partial immunity. If you stay outside those places for even 6 months, when you go back, you may find that when you are now bitten with the mosquitoes again, then you develop the signs. Yes.
Okay, Joffrey, have you thought of taking the antimalarials, or do you ever take them before you go home?
I usually forget even taking those antimalarials. Then I just go up country. But when I'm in Busia, I usually ensure that I sleep under the nets. But I don't know why, most of the time when I come back, I usually get malaria.
Many of us are told, for example, if you're going to visit the coast, Kisumu, and areas like those, take your antimalarials. Is this a good thing to do in as far as our immune system is concerned?
The things that someone needs to do is to look at some of the more common measures to prevent malaria. So making sure that one sleeps under a mosquito net. A mosquito net that has been treated with an insecticide is very important. Using protective clothing, so for example, wearing long-sleeved shirts and trousers, that really helps. Using mosquito repellents. We don't routinely recommend taking antimalarials when people are visiting those places, and you should really stick to those preventative measures before, because some people may react to some of the medicines that are there, and sometimes there's also risk that, for example, you may actually lead to resistance developing to some of those medications.
Somewhere like Mombasa, it is hot. So I cannot walk around with a long sleeve covered up because the temperatures won't allow me.
Mosquitoes tend to breed a lot in places that are wet. So for example, if there are swamps with standing water, mosquitoes may actually be breeding there. So if the health authorities work to actually reduce those ones, then you'll find to reduce the number of breeding sites, and hotels put on nets on their windows. Then if you use your preventative measures, then your chances of getting malaria much lower.
Have you ever had an incident where it was misdiagnosed to be something else?
Fortunately, I've never experienced such an incident, but I really ensure, on my side, I really ensure I visit like 2 to 3 clinics. Malaria usually have a lot of symptoms which are the same as typhoid. So I really want to avoid those two, the symptoms here colliding.
What happens is that when you just do one test, you may actually miss malaria even when the person has malaria. Usually for you to actually rule out malaria, you need to actually do up to 3 tests, 3 slides, done 8 hours apart. If they are all negative, that's when you can confidently say that this person actually doesn't have malaria. And that is where you will find that currently the government, working with its partners, they've introduced another test, which is called a rapid test, for which you don't look at it under the microscope. You take a small sample of blood, put it in the test device, and then it will draw lines. So if it draws 2 lines, you know this person has malaria. If there's only 1 line, then you know this person doesn't have malaria.
Now, Joffrey, as Dr. is saying, it takes a few days before the symptoms manifest. For you, when you come back from Busia, it takes how long for you to start feeling the symptoms?
Usually take 3 weeks or 2 weeks. Yeah.
Okay, Dr. I'm asking that question because there are some people who show the symptoms immediately. Then there are others, it takes a long time. What informs the discrepancy?
So the symptoms for the most common type of malaria that is in Kenya, which if I use the technical term is called the falciparum malaria. Usually the symptoms can develop anywhere from 7 days to as far as 28 days from the time somebody got infected. Then we have other milder forms of malaria, other types of malaria caused by other species of the parasite. If I use technical terms again, there's one called Malaria and Ovale that are there in low quantities in Kenya. These ones do take a longer time to develop. They don't develop as fast as the falciparum, so their symptoms may occur much later.
All right. Malaria has been killing people and more people all over the world, and it seems to be a thorn in the flesh. Why do you think that is?
When we look at the figures from the WHO that have recently been published, every year about 440,000 children die every year from malaria. But this is really a reduction when you compare to the figures, for example, in 1990, when up to 1 million children used to die annually from malaria. And this reduction has been to several efforts that have been there. For example, one of the things that was done earlier on was to change from medicines that were no longer working very well to medicines that work very well. There was introduction of the bed nets that people were not using before. So really, malaria still remains a problem because these preventive measures that are there, they've still not been able to reach everyone who requires them.
So, Joffrey, several bouts of malaria. I'm sure you have siblings. Do they also have the same problem as you do?
Funny enough, I usually get malaria and some of my siblings don't get the malaria. I don't know what is the issue.
Okay, maybe Dr. can tell us.
It could be an issue with the immunity in that different people exposed to malaria, some may develop immunity eventually, some do not develop immunity as good as others. But then there could be other things. Maybe Joffrey doesn't use his nets very well, like his siblings. But what we know is that for people most at risk of malaria, often they are children aged less than 5 years. Even if they are living in the areas with a lot of malaria, often they've not had time to develop the immunity, because you develop immunity from repeated infections. So when children grow older, those who survive are more likely to develop immunity from malaria if they are living in those areas. The other people at risk are like pregnant mothers. Even if they normally have immunity, that immunity goes down during pregnancy.
The other modes of malaria transmission, mother to child, especially during pregnancy. Which others?
If somebody gets transfused blood that has malaria, or injection use like sharing needles, but that's really rare.
Okay, let's talk about treatment now. Joffrey.
I used to use Coatem, and nowadays there's this Lonat. As long as there's this, I don't know if it's called Dactari Artemether or Lumefantrine, has something of the sort. I usually check them, and I know it's supposed to be the first dose 4 in the morning as when you start, then after 8 hours, take again 4. Then it's supposed to be, I think, 24 tablets for 3 days.
Okay.
But I ensure I finish the whole dose.
As Godfrey mentioned, what are called artemisinin-based combination therapies. This is the first-line drug that we use in Kenya. So usually it's a drug, they come 2 drugs, put it one, they are combined together. That's why it's called a combination therapy. One drug works very fast to clear the malaria from your body. So within a course of 3 days, usually you should have cleared the malaria. But then there's another drug which stays in your body for long. Although you take it for 3 days, but it stays in your body for up to about 28 days. So it ensures that the parasite, there's still enough drug for a long duration to ensure that the parasite is properly killed.
But we do know cases of resistance where you will hear somebody saying malaria yangu isikiangi dawa. Okay, so what causes that resistance?
The problem with some of the medicines we had in the past is that they were single drugs. The only, like chloroquine was one single drug. So once the parasite knew how to fight it, then there was no way in which it could be effective again. And then, so that's why current medications have more than one drug so that the parasite cannot be clever. Yeah, so the most cause for resistance is that people not taking their medicines properly. So you find that the missed doses, so often you find that there's very little drug in their body, so the parasite knows how to fight that little drug, or not very common in Kenya, but in other countries you may find where people do not use substandard, where people use substandard medications. But in Kenya we do not have that problem.
Okay, and what is the role of over-the-counter drugs?
If you give drugs to people without malaria in the first case, they'll be walking around there with very low doses of the drug in their body. So if the mosquito bites them and infects them with malaria, that parasite finds very low doses of the drug in them. So it trains itself how to fight the drug. When the mosquito bites and transmits the parasites to someone, then it transmits ones which are resistant. So generally people using drugs when they don't have the disease is a big problem. The second one is where people do not use the doses as recommended. So if the pharmacies sell the drugs but they don't tell people to use them properly, then again people may use very low doses, they miss the drugs, so that improper use may actually cause resistance.
Joffrey, in your various cycles of treatment, how much would you say it costs to treat malaria?
Testing is 200 shillings when you just go to the clinics. Okay. Yeah, on the higher side it can go up to, when you go to this big hospital, it can go on the highest up to 700. And now the full dose for malaria, like the Lonat, I think it's 200 or 350 shillings.
For the whole dose?
Yeah, for the whole dose, that is.
Is there any special consideration in public hospitals for people probably who have malaria and can't afford to treat it?
What I know is that children under 5s are not supposed to be charged when they go to public hospitals. So you would see that a lot of these children would be able to access treatment without actually paying for those services. Even pregnant mothers, they are supposed to, during their pregnancy, For a nominal fee, they are supposed to get a bed net to use at home, and also to have what we call intermittent preventive therapy, which is they get regular doses of malaria treatment to prevent them from getting malaria disease during their pregnancy.
What are the risks to your liver if you're frequently exposed to malaria?
When somebody has malaria, if they do liver tests, if you test to see whether their liver is functioning properly or not, you may find that they actually, it appears like it's having some problems, but when eventually, usually when they recover, that they recover fully well, so they don't have problems with their liver long term. While malaria may not have long-term complications in the liver, it can have complications in other parts of the body. For example, when malaria gets into the blood, when it gets older, it tends to go and stick in deeper tissues, and those deeper tissues can include organs such as the brain. And when it's there, because of blockage of flow to parts of the brain or an inflammation that it causes around the brain, it can cause cerebral malaria. And cerebral malaria can have long-term complications in children who suffer from it. It can also go to other tissues. For example, it can go to the lungs, it can go to the kidneys and different parts of the body.
Now, Joffrey, I'm sure you know, like the rest of the country, that there is now a vaccine that's being given to children. Yeah.
It will actually reduce the death rates for malaria, and also that the suffering that comes with malaria, because you realize most of people in upcountry, they're not informed about malaria. Some of them, they may even take like even 1 month without getting tested. They're not sure about what they're suffering from. Yeah. That indeed, then you'll find them suffering even from like cerebral malaria. I think the vaccine it is going to be a very good initiative.
People need to remember is that it should be used in combination with the other preventive measures.
Gentlemen, Joffrey Oko, thank you for your time. Dr. Salma Ketch, pediatrician, and of course attached to Camry Wellcome Trust. Thank you for your time and educating us on malaria. And as you've had, you really need to take initiative in as far as protecting you and your family from malaria. Prevention is better than cure. Time now for the health tip.
If you've just eaten chocolate, for example, or something that sticks on your teeth, if you rinse your mouth off, it means you're not going to give enough time for that food to stay on your tooth for long enough for it to start producing the acids and everything. Also, the rinsing, kind of, if something was very acidic, for example, you just drank soda, if something was very acidic, then it means it's going to kind of not really neutralize, but decrease the acid content in your mouth, so decreasing your chance of getting cavities due to that thing.
We really appreciate your interaction with us on our social media handles. Keep them coming through. My name is Gladys Gashanjan. We have been coming to you from the Radisson Blu Arboretum. Until next time, see you. Remember, any suggestions you would have for us, we are... Hi. Check it. To again. Time now for the health tip. I need to do that again. Not from 4. Okay. So
know that when you get that phone call, the patient.
Any suggestions you would have for us, we are good people. Good.